Traditionally, a residency program is a focus of what you want to go into as a physician, what you want to practice. You graduate from medical school and then you decide what specialty you want to go into, and then you do that residency and that specialization.
Residency is really what's needed to take what they learn in medical school and make it applied, because so much of what you learn in medical school, textbook medicine, does not necessarily translate to the real world like any other profession. So this is the on-the-job training. This is where they learn to interact with patients and not only learn medicine, but learn the logistics of medicine.
As everyone knows, medicine changes a lot. And when you start medical school, between when you start medical school and when you finish medical school, that's 4 years. So a whole bunch can change in that time period. New drugs come out, guidelines change. Feels like every month now with the way technology is, there's something new happening every month in medicine. So this allows you to stay on top of all that. And you have mentors that are older physicians who've been practicing for some time that can give you good tips and just sort of oversee how your care of your patients is.
For the first time, they're called doctor, they're acting as doctor, perceived as doctor by their patients and by the nursing staff. And they take ownership now of their patients and are writing orders, fulfilling treatment plans, and actually practicing, but with supervision.
Yeah, I interviewed at a lot of different places, up in the Northeast, Connecticut, Pennsylvania, University of Florida. But the group here, I came here and they treated you like family.
There's great leadership at the hospital and then within the program itself, and it's easy to go work for people who are working real hard themselves. It's easy to get out of bed and do that.
TMH was actually one of the first community-based family medicine programs, and for a while the largest community-based family medicine program in the country. And what that means is that for a long time TMH's family medicine program had no affiliation with a medical school. Now we are affiliated with medical schools, including Florida State University, but we're still a TMH centered program that is not under the direct guidance of FSU. So we have the benefit of both worlds. We're able to interact with the FSU medical students, and we're also able to still be based out of a community medical facility such as TMH.
I love it. I came here, I was fortunate enough that I did a rotation while I was in medical school here. The interesting thing is I never really had intended on coming back to Tallahassee. I did my undergraduate here. Nothing against it, I love it, but just never really saw that. And I came here, loved it. Decided it was where I wanted to do my training and really never regretted it from day one.
It's a great place. It's a great community. There's the people here are wonderful. It's just a great place to be.
They learn a great deal in the 3 years they're with us. Those skills and knowledge expand dramatically, and their confidence to apply those skills. You have to be competent and confident, really, to go out into the world, and this gives them a chance to do that.